We're going to close today's program with one of the most quickly evolving fields in healthcare, cardiology. But before we introduce you to the Heart and Valve Center and the newest non-surgical treatment for valve replacement, I've asked Penny Burrows, a cardiovascular nurse, to quickly go over the symptoms to watch for as indicators of heart valve problems. Penny?
There are 6 main indicators with problems with your heart valve. Those can be shortness of breath. That can be whether you're at exercise or when you're laying down at night. You may need pillows to prop yourself up on. Weakness or dizziness, passing out can also be a symptom there. Palpitations or an irregular heart rate. Discomfort in your chest or pain in your chest. Swelling in your ankles, feet, or abdomen. And then a rapid weight gain can also be an indication. If you have any of these, please contact your healthcare provider.
Thank you for that reminder. I know how important it is to keep those symptoms fresh in our minds. And now to learn more about the recent advances in cardiovascular treatment, I've caught up with Dr. Knoll in the Cardio Hybrid Lab. Hi, Dr. Knoll. Thank you so much for your time today.
Good morning.
So I understand that the Heart and Valve Center here at TMH is really at the forefront nationally when it comes to cardiovascular care. What do you think is setting you apart?
I think the opportunity that we provide in a cohesive group, being non-invasive cardiologists, interventional cardiologists, and cardiothoracic surgeons, providing comprehensive collective care.
Now, when we talk about comprehensive care, I saw some of the offerings, your programs and your treatments online. There's quite a bit there. Can you list some of those?
Absolutely. We provide angioplasties, carotid stenting, coronary angioplasties and stentings, and we're also moving towards percutaneous aortic valve replacements.
All right, now that sounds like something I wanted to ask you about next. In your field, there are so many breakthroughs, medical advances happening really quickly now. What are some of those breakthroughs?
Well, percutaneous aortic valve replacement is the newest technology that's being offered. This is an opportunity to replace an aortic valve that's not working appropriately and do so in a manner that doesn't require open heart surgery.
A transcatheter aortic valve replacement, or otherwise known as TAVR, is a procedure in which we replace the aortic valve, a major valve on the left side of the heart, through a minimally invasive technique where we access the groin and implant the valve through the groin. This is different from the standard operative procedure where we open the chest, have to put the patient on a heart-lung machine, and then replace the valve surgically. So this is a new procedure that is less invasive and offers a different modality to treat these patients who are high risk for surgery. I think a picture's worth 1,000 words, and so we do try to draw a picture for the patients, use models and demonstrate what we'll be doing. A lot of patients understand the notion of a heart catheterization procedure, so they generally understand how we access the heart from the groin to do standard procedures like stent procedures. And we just expand on that knowledge base and tweak it a little bit so that they can understand how this relates to treating the aortic valve. The average length of stay for this procedure is about 5 days. So it is still a very major intervention for these patients, but we still feel that it offers a lot of advantages in the right patient to an open procedure, in that the recovery in many cases is less arduous for the patient, and oftentimes less in terms of hospitalization days.
So when we're talking about these medical advances, what does this mean for your patients? Are they able to live longer, fuller lives?
Sure. These are patients that have been turned down for surgery, so if they didn't have anything done, their survival would be less than 50% over 2 years. Because we're now able to offer this procedure, we improve not only their quality of life, but the longer they live.
All right, now as a cardiologist, what would you say is the most rewarding part of your day?
I think impacting patient lives always is the most rewarding, but providing new opportunities that patients previously couldn't have is a new challenge for me.
All right, great. Thank you so much for your time. I know you're very busy.
Thank you.